before we go, we could talk forever. I want to talk about the skin. And me personally, I've seen it where your liver is your detox organ, but your biggest detox organ is your skin. So if your liver is overwhelmed and can't do the job, guess where all that toxin's coming out? And the amount of rashes and mysterious things coming showing up on the skin just in the last 5 years has exploded. I had a wife email me saying, my husband has this skin rash that'll come and go, but now it's not going at all. He won't change his diet. And that was number one. I'm like, well, we might want to work on that. But he wants to know if there's one pill he could take or do something. But can we talk about the skin issues and that it's not just what's going on the inside that's causing the skin to react, but the skin reacting, causing the disease, and that bidirectional relationship that you are the only person that talks about. And it's so intriguing because we're seeing all of these skin issues in children and in adults, and then they're driving food allergies and other chronic disease.
Yeah, we talk a lot about leaky gut, and leaky gut is a very profound and dramatic issue, and drives a lot of risk factors for people. But we also have this issue of leaky skin. The skin is a definitive barrier, and it's supposed to function like a barrier where it doesn't allow things through, all the things that we're exposed to, right? And we just talked about how nowadays we're exposed to even more egregious chemicals, 80,000 plus that have been building up. One of the reasons I would say that when we were younger, we had less of a toxigenic impact from the chemicals we were exposed to then, in part because the concentration of these chemicals has increased over time because they're called forever chemicals for a reason, right? They're in the environment and in our areas where we live, breathe, and eat forever. They don't break down. So the chemicals that were being released in the 60s and 70s are still present today, right? So when we were growing up in the 70s and 80s and so on, we only had a fraction of those chemicals that we're exposed to. Now all those chemicals are there, including all the ones we've been releasing over the last 20 years or so, right? So at the end of the day, the skin is taking the brunt of a lot of that as well. And we are doing lots of things to dismantle our skin microbiome. So our skin has a very definitive and specific microbiome and ecosystem like our gut does. We can have upwards of 1,000 different species of microbes and bacteria on our skin. We have a very complex ecosystem on the skin, and those microbes play a very important role in the health of the skin, the function and the barrier function of the skin as well. And so when we disrupt the skin microbiome, we start to disrupt the barrier system of the skin. So studies have shown that when the skin's microbiome starts to get disrupted, it starts to present itself in common ways that we associated with skin and cosmetic issues. So, for example, redness and sensitivity in the skin, right? Acne, or other inflammatory related conditions on the skin like eczema, psoriasis, atopic dermatitis. These are all a function of having dysbiosis on your skin as a step one. Just like IBS and Crohn's and colitis and all that are a result of having dysbiosis in the gut. All of these skin manifestations are a result of dysbiosis on the skin. This includes aging related symptomology, so fine lines, wrinkles, thinning of the skin, drying of the skin, also hyperpigmentation, discoloration. They're all a sign, symptom, and signal of dysbiosis on the skin. And while all those things are happening, the other thing that's occurring is the skin is becoming leaky. So antigens and chemicals in the air can actually leak through the skin and make its way into circulation and create systemic inflammation. Right? There's a study called the Baltimore Longitudinal Study of Aging, which is still going, and it's like a 65-year study looking at age-related drivers of disease. And the researchers, and there's I think over 5,000 papers that have been published from all of the research going on with this. the researchers have identified that the number one predictor of mortality and morbidity in individuals in the Western world is the health of their skin and
Mm.
aging of their skin, right? The age of the skin was the best predictor for their development and their risk of developing chronic disease and dying from that chronic disease than any other marker in their body, right? And they showed that the dysfunctional skin shows up years before the disease pathology is realized. So they can connect how aged and dysfunctional skin can lead to osteoporosis, right? Age and dysfunctional skin can lead to Alzheimer's and dementia and diabetes. You would never think that, right? You would never think that your skin has anything to do with your bones, but they absolutely do. It's all a connected system. And so when you look at kids, for example, or even adults, when you think about the increased prevalence of things like allergies and asthma and peanut allergies and all those things that we weren't ever accustomed to when we were growing up, part of the reason that's happening is because there's an epidemic of skin disorders in kids as well, right? Eczema is such a huge problem in kids right now, in part because we're not, we've got a lot of C-section births, they're using a lot of antibiotics, we're over cleansing the skin, we're using products with antimicrobials, all of that. So the kids' skin microbiomes are becoming dismantled. They're losing the barrier function on the skin. Then what happens is things like peanut allergens and antigens from food and the environment actually penetrate through the skin, end up in circulation. Because that's not going through the normal route of the gut, the immune system does not know what to do with it,
Mm.
because normally those things enter the body in the context of the microbiome, right? So remember, the microbiome can train the immune system on how to deal with a peanut protein or dairy protein or an environmental allergen, right? When it goes to the skin, the microbiome's not there, the gut microbiome's not there. So the immune system just sees it and freaks out and just throws everything at it. Histamines, leukotrienes, IgE, all of the hypersensitivity responses. And then what tends to happen is kids become allergic or hypersensitive to those antigens, right? This is why asthma and allergies are at
Mhm.
epidemic levels in our population. Same with skin disorders, right? So thinking about it from a biological mechanistic standpoint, we have to take care of our gut, our liver, our skin microbiome, our oral microbiome, all of the biomes that drive our system.
And with the skin microbiome, we use sieve, and you are the genius behind that. Can you explain how that helps with the resilience of your skin microbiome?
Yeah, very similar to how these spores do it in the gut. That we've identified a couple spores that can do the same kind of competitive exclusion on the skin, meaning they get on the skin. They can read the microbial environment through this quorum sensing mechanism. They'll bring down dysfunctional bacteria like Staph aureus, for example, and can increase the beneficial bacteria on the skin, thereby changing the barrier and the function and health of the skin. We've got amazing results on inflammatory things like acne and eczema, but then we're also seeing a huge response on age related symptomology as well. So it's great for kids, it's great for adults. I use it every day, of course, on my face and then on my body as well. I mix a few drops in my lotion before I put it on. Or if there's ever any irritated areas like red areas or pimples and things like that on your body, I put it directly on there as well. But it makes a world of difference because it provides that protection and rebalancing of the skin microbiome.
Any reason you wouldn't want to mix it with castor oil for a delivery system? Because it's very potent and very small drops that come out of the supplement.
Yeah,
Could you do that?
you could. Yeah, you could mix it with some castor oil. If you're using castor oil or castor oil packs
Mhm.
on your skin, you can absolutely mix it with that as well.